Hi guys, I'm going to teach you how to install the quick fill syringe into the pump injector to get it ready for EVAR or angio when we're using the pump injector. We're going to turn it on the side. It's going to go through its quick checks. Light's going to go, the orange dial's going to wing, and you're going to hear bells and whistles. This little important safety notice is going to come up telling us about air embolus, what to look for, and the cross-contamination. We're going to press continue once we've read it. We're going to get to this screen. And if you look at this little drop box right here, that is actually a step-by-step on what we need to do. I do have it written on the little how-to sheets normally hanging on the side of the machine. I just have it up there for right now. So it says install the quick fill syringe. So we're going to take the quick fill syringe and we're going to have the ridged edge lined up with the arrow. You're going to slide it in. This is the drop box. So I hold this down. As you can see, it's a little pushy. You hold it down and you just sling the drop box on. It might have a little bit of tightness like that, so you're going to have to play with it a bit, as you can see for me right now. So I want to release the orange a little bit. So let's just push it back. I'm going to release the orange hub a little bit here, the cover. Bringing it up, line it up again, and it's going to sit, and it's still a little loose, which is perfect. We need to advance the plunger so we can actually get the VisiPake inside. So we press the engage button and press the blue forward button so the syringe, the plunger goes up. We're now ready to fill it with the VisiPake. Scrub nurse will take her candy cane and the VisiPake that's in the bowl. Circulating nurse will take the the orange cap off and stick it in there, keeping the round parts sterile. So scrub nurse is going to stick it on, and now the circulating nurse will press engage, and we're going to fill the syringe up. Just fill it full. This is water, so obviously we're going to have quite a bit of bubbles. If this was the VisiPake, there's minimal bubbles. Normally they'd be sitting in a hub like this. Circulating nurse is going to hit the syringe and get the bubbles up to the top. Circulating nurse will press the button, and we're going to advance. As you can see, the bubbles going through the candy came back into the scrub nurse's bowl. At this point now, once all the bubbles are gone, again, disregard this because this is water. We're going to press engage. Circulating nurse is going to press to fill the syringe to 150. Scrub nurse is going to make sure that the bottom of the candy cane stays in the bowl, that we get no more air. At this point now, if you take a look, it says rotate head up and purge. This head is already up. This wants us as a scrub and circulating nurse for the internal sensor here to purge this system. If you see the knob down here, the orange knob, you're going to see a little picture beside it that looks like a syringe. You want to turn it towards the small end of a normal syringe. As I'm turning that, if you can see on the screen, that rotate head and purge is going to go away. We're going to twist that until we see that line go away. There, now it says rotate head down to arm. This system right now, from the scrub and circulating nurse point of view, is ready to be engaged for the surgeons. So scrub nurse will take the candy cane off, keeping it sterile, let the VisiPake go back in the bowl, put it back on her back table. We'll take the orange cap and we put it back on, waiting. We can turn it down, as it says, to get ready to arm. Bearing in mind that now when Dr. Kopak or Houston want to attach their connector tubing, they're going to be sterile. So for them to come down here, they potentially could contaminate themselves. So what we graciously will do for them to help them is to maybe bring it back up to 45 for them. We will take the cap off as a circulating nurse, put it back in the nubbin here, and the surgeon will attach, obviously sterile, because this is still sterile. He will attach that in, slide it in, and he's going to twist this down. And as you can see the angle that I'm coming from, that's how hard it's going to be for the surgeon and them to do that. And they're going to twist it down, keeping themselves sterile. So we will put it fully down now, because Dr. Kopak will have, or Houston will have the this tubing in their hand. They will ask for a bowl. Scrub nurse will have a small bowl for them, because the line will need to be primed because it hasn't been primed. So they're going to ask you to take the nubbin, orange knob, and they're going to ask you to twist it clockwise. What they're doing is they're wanting the fluid from the syringe to get into their bowl, so they've primed the line, and the line is primed. Now, they will take a snap and this end, and they're going to snap it up to the patient. And this, once they attach it to the patient, pretending a patient is here, they will ask you to go counterclockwise. Like if you had an IV and you want to pull back and make sure it's sitting in the area that it needs to be, they're waiting for blood to come back. At that point, once this is up with them and they're holding it, that is ready to go. They will ask you to do a run. And basically what you're going to do is you're going to press arm. It's going to ask you, have you expelled air from the syringe? You're going to say yes, because Dr. Houston and Kopak asking you to go counterclockwise and clockwise. Once it's up to their patient, you have done that. You press yes. You're going to see that now yellow light says it's armed. The white comes on. This system is ready. You're going to take the little controller from the back here, and I'm going to pretend that this is the patient and we're going to do it. Dr. Kopak or Houston will say to anesthesia, I want to do a run. We will tell them it's 10 for 20. On the screen, we can change that if they wish. They will say yes. They are then going to say, hypothetically, Dr. Draper, apnea. They're going to look at us and say inject. We're going to press the button and hold, and we're going to say injecting, still injecting, still injecting. Once we see injection complete, we say that to them. We release our finger off the white knob, and he can do as many runs as he wishes. You will see here, that's a total contrast for the circulating nurses to keep count of. What the scrub nurse uses on her table needs to be added to that. To disconnect this at the end of the case, this little guy can stay back on. We're going to say end case. We're going to say yes. It goes through its little thing. We're going to turn this guy all the way back up. Turn it to ourselves here. We're just going to release the drop box. We're going to turn this. If I'm facing, it's facing me and it's there. We're going to turn it to the 3 o'clock position if the clock is, it's 9 o'clock or 3 o'clock. We're turning it to this side if I'm facing it. So the 9 o'clock position. Pull the syringe out and it can be discarded into the garbage. And that is it. Hopefully this helps. I'm going to try and put it on the desktop in room 4. And Mary Lou, who's filming me, thank you, is going to try and help me send it to everybody so you guys can put it on your phones. Thank you.